Hi everyone, welcome back to Mad Barn Academy, and if you're new here, welcome. We hope to earn your subscription today. Our video today is part 2 of the 3-part series on equine gastric ulcer syndrome. If you haven't seen part 1, go ahead, pause this video, go watch part 1. The link is in the description below. It's really a great lead up to today's video. So our focus for today will be on the diagnosis and treatment of equine gastric ulcer syndrome. Certainly, dietary and management strategies for ulcer prevention also apply to treatment, but it's a lot to cover in one day, so I've reserved that topic for our last part 3 video. Okay, let's get started. So as a really quick review from part 1, ulcers can develop in either the squamous or glandular regions of the stomach or both in some horses. The reason that this is important is because the disease processes are different for these different types of ulcers, which means that treatment is different. This is why getting a really accurate diagnosis is so important. You want to know what area of the stomach you're dealing with so that you can correctly treat it and address those underlying risk factors to prevent future ulcers. So, what clinical signs might a horse exhibit if they're ulcery? Well, unfortunately, there is a really wide range of clinical signs, and every horse is different in how they present. They can sometimes, or this can sometimes make coming to a diagnosis or at least coming to the decision to pursue further testing a real challenge. What's more is that the severity of clinical signs do not always correlate with the severity of ulcers present. So some horses are very stoic and tolerate discomfort better than others. Others, are much more vocal, if you will, about their discomfort and, display more irritable signs, aggressive signs, or issues under saddle, things like that. So the other thing to think about too is that some of these clinical signs are somewhat non-specific, right? Poor performance could really be a whole host of things, or weight loss could be attributed to a lot of different things, etc. So really, that's why it's really important to involve your vet in a full workup to come to an accurate diagnosis so that you know what you're dealing with. So, for diagnosis, gastroscopy is the gold standard for diagnosing gastric ulcers. Gastroscopy is a really easy, non-invasive outpatient procedure. It's performed under standing sedation after a period of fasting. So, in most cases, those horses will be withheld from food for about 12 hours and then a minimum of 4 hours off water prior to scope. And that's just because the stomach has to be empty for us to really get a good visualization of the entire structure. And any food in there can really obstruct the movement of the scope through the stomach. So, and basically what happens is the horse is sedated, that gastroscope is passed up one of the nostrils to the back of the mouth or the pharynx. It's swallowed into the esophagus, passed all the way down into the stomach. The stomach is then going to be dilated with air, so it's going to be blown up so that we can really see all the way around it. And then once the exam is complete, that all that air is taken back off the stomach, it's deflated, and the scope is removed. Horse wakes up. So if ulcers are identified on gastroscopy, then the vet is going to want to grade or describe them. We have an accepted grading system for squamous ulcers, and it ranges from 0 to 4. 0 is considered a normal stomach, and then grades 1 through 4 are going to describe some range and severity of those squamous ulcers. Now, for glandular ulcers, which are most often seen around the pylorus, we don't have a formal grading system at present. And that's just because there can be a lot of real variation between different lesions around this area. So researchers just haven't been able to establish a real formal rubric yet. But so instead of, grading something 0 through 4 or, whatever number, these lesions are really going to be described descriptively. So the vet is going to, list out, how many lesions are there, their degree of severity, and then characterize them. Are they red? Are they elevated? Are they ulcerated, etc.? So some other diagnostics that are out there include the fecal blood test, which is a stall side diagnostic that is looking for components of blood in the horse's manure, so either hemoglobin or albumin. If hemoglobin is detected, that means that there's bleeding from somewhere in the GI tract. That could be the stomach, that could be the hindgut, it could be anywhere along those 100 feet of bowel. Conversely, if albumin is detected, that means that the blood is undigested. And so that albumin is going to be coming from somewhere in the large intestine after the small intestine, since that albumin would be normally digested within the small intestine. So fecal blood test certainly is a convenient tool, and it has its place in diagnosing ulcers, but owners should be aware that there are some limitations with this test, which is why it's not our gold standard compared to gastroscopy. So it's not going to be super specific about the location or the type of ulcer present, though we can make some assumptions based on the results that we get. It's also not going to be able to detect non-bleeding ulcers, which misses those horses with those lower grades, squamous grades 1 to 2, maybe even a 3 squamous ulcer, and then certainly those non-bleeding glandular ulcers. Okay, moving on to treatment. So when we talk about ulcer treatment, there are a couple different strategies used to promote healing in the stomach mucosa. One is to make the gastric acid less corrosive, either through neutralizing that acid and making it more neutral pH, or through acid suppression, so actually decreasing how much acid is being secreted into the stomach. 2 is to coat those ulcers and protect them from acid so that they have an opportunity to heal. And then 3 is to kind of essentially restore balance to those innate protective mechanisms that may be compromised. And we talked about those mechanisms in the part 1 video, that mucus bicarbonate barrier in the glandular region. So there are several different medications out there, but most treatment protocols today focus on 3 particular drugs: omeprazole, sucralfate, and misoprostol. Omeprazole basically suppresses gastric acid secretion in the stomach, and it is the gold standard for squamous ulcer treatment. Omeprazole may be combined with sucralfate, which is a coating agent for the treatment of glandular ulcers, or instead misoprostol, a synthetic prostaglandin, may be used for the treatment of glandular ulcers. So for when we're using omeprazole for the treatment of squamous ulcers, the traditional treatment protocol is usually a full dose for 28 days. And research has shown that we can achieve really quite excellent healing rates within that first month of treatment, anywhere from 70 to 77% consistently reported. Those 23 to 30% that don't fully heal within the 28 days would probably receive an extended treatment. And there's also some research to show that a large portion of more mild squamous ulcers resolve in the first 14 days of treatment. So really that first 14 days is kind of the most important window for ulcer healing. And that means that some cases may not warrant that full treatment course, but that's certainly going to be at the discretion of the veterinarian. So historically, when we talk about using omeprazole, there's been a great deal of concern over this concept of rebound gastric hyperacidity, or RGH, which is the phenomenon that upon cessation of omeprazole treatment, those acid-producing cells in the stomach that have been blocked by the drug undergo this rebound in gastric acid production. And this is something that's a significant concern in humans that take omeprazole for gastric ulcer treatment. So, to combat RGH, the recommendation has often been to taper or wean off that omeprazole course over several weeks after that full dose. However, there's been some recent research that seems to show that this effect is potentially not as severe or even as prolonged as we initially thought, and that tapering may actually not be necessary. So instead, these researchers recommended nutritional support during this kind of critical 48-hour window once that omeprazole is stopped. As well as avoiding exercise and transportation, which are, common stressors that are going to potentially lead to ulcer recurrence during that time frame. So, switching gears to glandular ulcers, unfortunately, omeprazole alone is not very effective for the treatment of glandular ulcers. It may be combined with sucralfate for treatment, or misoprostol will be used. There's a lot of promising research about the superior efficacy of misoprostol for the treatment of glandular ulcers compared to other meds or medication combinations, but more research is really still needed to determine if it really is the best option for every case of glandular ulcers. Okay, so that is going to cover our part 2 video. For our final installment in part 3, we'll discuss prevention strategies and dietary management for equine gastric ulcer syndrome. So be sure to check back soon for that part 3 video. And here are references for today. And I really appreciate you guys taking the time to listen. Don't forget to like and subscribe. Explore the other videos on our channel. We've got some really good ones. And check out the additional links I've provided in the description below. There's a couple links to our blog articles on gastric ulcer treatment. So until next time, see you for part 3.